Hello! Good day to you. Studies show that in the United States every year, more than 4 million children are exposed to a traumatic event. 4 million children every year. Imagine that. So parents, it's finally becoming common knowledge now how serious this problem of trauma is. So with this video, let us learn together a few basic things about trauma and trauma prevention. The first thing you need to bear in mind is that trauma is in the nervous system. Trauma happens in the body, not in the event. Trauma happens when any experience stuns us like a bolt out of the blue, and we are just overwhelmed. It overwhelms us, leaving us disconnected from our bodies. Now, vulnerability to trauma differs from person to person, but always remember this, parents. The younger the child is, the more likely he or she is to be overwhelmed by that traumatic event. Why? Because there is no time to think when you are faced with a threat or a traumatic event. And so our primary responses are instinctual. The brain's function is just to survive. It's just to survive because we are wired for survival. And so, when that happens, the body has to release a large amount of energy. When a person does not understand what is happening to him or her internally, then he or she bypasses active response and will just shut down. And that's the reason why younger children have fewer responses to protect themselves. They are the main victims. Now, what are the main causes of trauma? A few of them are sports injuries, car accidents, near drowning, near suffocation, life-threatening illnesses, animal attacks or poisoning, bullying, family violence, watching violence, physical and sexual abuses, neglect, death of a loved one, death of a pet, separation, and natural disasters like fires, earthquakes, floods, and typhoons. So, what's our emotional first aid to trauma? What is a good band-aid to trauma? Parents, you need to bear in mind that first, to have a calming, centered adult presence is very necessary when you are faced with a child or a person who has experienced a traumatic event. You need to be calm. So if you are not, you find a comfortable place to sit down and go back to your breathing. And once you are calm and relaxed, you are now ready to attend to your child. Second, assess the situation. Assess the situation is when you check the facial expression of your child, particularly the eyes and the mouth. Are the pupils dilated? Do the eyes appear glazed or vacant? Pay always attention to the breathing of your child and his or her heartbeat. Is the breath rapid or shallow? Is the heart pounding fast or unusually slow? Is the child overly emotional or hysterically crying, screaming in terror? Observe everything that's happening in the body of your child. Third, tell the child that his feelings or her sensations are okay, that they are normal reactions to a traumatic event. But assure him or her that the worst is over. The worst is over. And your presence will help her. To take care of him or her is your top priority. That you are there to protect him or her. That you will stay with him or her until he or she begins to feel better. Fourth, trust in your child's innate ability to heal. That the soul in each one of us has this inner healer. No? We will just heal. Your child will just heal in due time. Fifth, encourage your child to rest, even if she does not want to. Always remember that sleeping, resting is the best therapy. Do not stir up discussion or ask him or her a lot of questions about what happened, how does he or she feel. No, allow your child to rest first. Six and last, when your child has rested and is calm and relaxed, set aside some time for you to talk about her feelings. Now is the time to talk about her feelings and about what really happened. Normally, children would tell you that he or she feels anger, fear, sadness, worry, shame, guilt. Help the child to know that his feelings are okay, that his feelings are normal, and you understand them. Assure always the child that you are there to protect him or her. The worst is over, and you will be there until he or she feels better. You can use art materials for the child to allow, to creatively express himself, herself. Use drawing, crayons, or clay, whatever you have there.